Hi everyone, my name is Ghadeer Alarayedh. I am a recent doctoral researcher. It's my first year. I have just started my PhD journey last November, 3 months ago, at Brunel, University of London. My master degree was from the University of Bradford. Also, my bachelor degree was from there in the United Kingdom.
1 second, Ghadeer. So if you can reduce the noise coming so that Ghadeer can... Go ahead, Ghadeer.
Thank you very much. I have an associate degree in medical laboratory technologies, and I have attended more than 100 workshops, conferences, and lectures all around the world, and I hope this will aid me in writing my thesis. I would like, first of all, before I start my presentation, to thank Dr. Brian McIntosh from the Brunel University, London, and Dr. Noor Sayed from Ahlia University for all their support. Although I'm just a starter in my PhD, but my paper has been accepted for publication. First of all, if we would like to introduce, maybe because my title, it might not be very familiar for most of people. What is holistic therapy? Holistic therapy is based on 5 main things. It's based on physical, mental, emotional, social, and moral aspects of human health. In other words, it's a coherent approach of healthcare. And the base of this holistic therapy is on the law of nature. The law of nature that the human body is made of interdependent parts, and the treatment of any part should be as a whole person. For example, you cannot treat any person having a headache just from this side. You should go on these 5 main aspects and then start the treatment for the patient. And even though, for example, the disease symptoms, it's not just a guide. For nowadays in the conventional medicine, if you go for a doctor and you told him about your system, he will directly give you a medication. But the disease symptoms is just a guide, and should you search for the base and the original cause of the disease, and then started the treatment. As you can see from this small picture, that in holistic medicine, every patient is unique and is not an example of any disease, and every cure should be unique for every patient. This is the main research problem. What is the effect of this hybrid model of holistic therapy in addition to modern conventional medicine, or in other words, we can say Western medicine, how we can combine these both therapies, and what is the effect of this combination on patient health, as well as is it going to reduce the hospital cost, and also how you can introduce this model in both certified public and private healthcare centers. Who will benefit? This is the main and a very interesting question. Who will benefit from this model? Actually, there is a broad spectrum of stakeholders who will gain valuable benefit from this study. First of all, the patient. Which patient? The patient that aimed looking for a certified holistic therapy with minimum side effect when they combine the holistic therapy with the conventional therapy. Secondly, hospitals who aims to reduce the treatment cost and would like also to reduce the hospitalization, which in other words will cost the hospital too much. And also, it's very important for healthcare centers who want to adopt a novel therapy using this hybrid model. Starting the literature review, it is really important to find the physical treatment for any disease, but it's also very important to find the cure of the patient as a whole, and including his surrounding. This literature review provides a broad overview on studies and mainly recent studies articles. For example, in new researches in the US, they found a significant increase in patient numbers who seeks various methods of alternative therapies, and because they feel that these treatments are more compatible with their own values and matching their health decisions. I would like just to give you a small note. For example, alternative therapy, complementary therapies, they are both just a part of the holistic therapy, and they are not the main, in other words, they are not equal to holistic therapy. Holistic is more bigger than alternative and complementary therapies. Studies shows 50% of general populations, they are using non-prescribed complementary therapies, and there is also a proven relief. Higher education, gender, for in instance, females, and if patients are suffering from chronic diseases like diabetes or life-threatening diseases like cancer, these all increase the use of complementary therapy in addition to modern therapies. Continuing the literature review, for example, Brunel et al., he support the evidence that people with mental and stomach illness, they are more likely to combine the both medicines with integrative and complementary health approaches. And this developed a phenomenon that calls medical pluralism, which is that using multiple forms of treatments to cure the same disease. And this is a very interesting study. That's only 4.8% of the people, they are strictly using conventional medicine or Western medicine, while most of people, they are using multiple or combine the both therapies for their diseases. Just here, I'll give you an alert. It's very important that even in the conventional therapy, if you take, for example, take any two medication, there will be a side effect, or there may be an interaction and may lead to serious side effects. A reviewed study shows unwanted interaction between herbal medication and modern conventional medicine with the clinical significance, and in some cases, it is life-threatening. For patient safety, any combination should be under professional supervision to avoid herbal conventional drug interactions. Here an instance for cancer patients, doctors, they prevent them from taking their medication along with meals or along with the other complementary medicine or along even with mineralized water. They should take their medication with non-mineralized water to avoid any interaction. Therefore, the medical observation is in this hybrid model of therapy is recommended. What are the benefits from this hybrid model of therapy, combining the conventional and holistic treatment? There will be a higher patient satisfaction, better expectation, positive outcome on patient life quality. Also for physicians, there will be a sense of confidence, and definitely there will be a cost saving. Even though there are many benefits, there are also a few challenges of this hybrid model of therapy. The way of introducing this hybrid model of therapy is really, in a certified hospital, it's really important how you can introduce this model. There is limited insurance coverage for holistic therapy, so you cannot even decide the cost saving and cost effectiveness of this combination. The herb-drug unwanted interaction, as we explained earlier, and the ethical and the treatment license approval also is a main challenge. As a conclusion of my presentation, the introducing of a hybrid model of conventional Western medicine and holistic therapy in a certified healthcare provider institution is the main aim of this literature review. Treating patients as a mental, physical, spiritual being using both these mode of therapies will show beneficial effect on both patients, physicians, and healthcare institutions. And this integral medicine treats patients from all dimensions, and it has been seen that it is a cost-effective, expensive, especially in chronic illnesses. However, in acute illnesses, it's really not the same way. And finally, careful supervision on complementary practitioner will reduce any unwanted herb-drug interaction. As a future research, I would recommend more studies needed on the appropriate practical strategies on introducing this hybrid model in both private and governmental hospital. And the main aim is to having a higher treatment quality in addition to a cost-effective basics. This is the end of my presentation. I'll have you interested from it and have some benefit. And references are also available.